Alright, today we are going to learn how to take alginate impressions. The first thing to do is to have the correct armamentarium, which is just a fancy word for saying all the stuff you need to do that. So, the first thing is the basic kit. Anytime you have a patient in the chair, you typically will have a basic kit: mirror, explorer, probe, the air water syringe, and your cotton forceps. We have everything we need for taking impressions: the alginate itself, your mixing bowls, your spatula, your water for the alginate, and then your impression trays, which are sized for the patient you have. In addition to those items, we have dry paper towels to help the patient clean up, and then some wet paper towels for the patient to clean up, but also to wrap your impressions after they're done so that they don't distort. Alginate impressions can distort after 24 hours, so you always want to keep them wet so they don't dry out. Finally, we have a bag to put your impressions in once you're completed. So that completes everything that you need for alginate impressions. Now let's go over a few things on how to take them. The first thing you do is you measure out how many scoops you need. Typically, you'll use 3 scoops of alginate for an upper tray, and usually around 2 scoops for a lower tray. The first thing you need to make sure with your alginate is that it's not compacted tight. So you'll take your scoop out, and you'll make sure that your alginate is really nice and fluffy. As it sits, it tends to compact, and you'll end up having too much alginate and not enough water. So once you have that done, you'll measure out your 3 scoops for an upper tray by tapping it on and then scooping it out. There's 1 scoop, 2 scoops, 3 scoops. Okay? Then you'll measure out your water. And there you can see on these measurings, there's 1, 2, 3 lines for either 1 scoop of powder, 2 scoops of powder, or 3 scoops of powder. And since we have 3 scoops of powder, we've filled it all the way to the top. And so now we're actually going to take the alginate impression. The first thing you want to do is position the patient. The patient should be nice and even about chest high with you, and then at a 45-degree angle or slightly higher. The reason why you don't want them all the way back is because the alginate will tend to flow back down their throat and might cause them to gag, which you want to try to avoid. Speaking of gagging, you never want to mention gagging with a patient, because once you mention it, the likelihood of them gagging increases drastically. So the first thing you want to do is try in your trays to make sure they fit. So you want to be able to encompass all of the teeth with enough border on all areas so that you can see everything you want. So you're going to use your mirror to try that in, just like that. And you notice how it extends all the way around the teeth and gives us ample room for the alginate to flow around. When you go to seat an impression, you want to seat it from back to front. And that way the alginate flows all the way up and around her front teeth. So that tray looks like it fits pretty good. So now we're going to mix up the alginate. We got 3 scoops for a maxillary impression, along with 3 scoops or 3 amounts of water for the necessary scoops. So the first thing we're going to do is I always hold my tray in my fingers right there so that we can load it pretty good. I got my spatula ready to go. We're going to put the water into the alginate, make sure that it's nice and wet, mix it around, and then we're going to start to spatulate it pretty quickly. And what you're trying to do is get all the air out of there, as well as making a nice smooth mix so it's not lumpy bumpy. And so you're going to see it tend to smoothen out, and you're pushing it along the sides. I'm spinning the bowl and mixing at the same time. Once it's fully mixed, you'll scoop it all out and then start putting it in your tray. Just like that. And you'll move it around. Now, the biggest thing you don't want to do is overload the tray so that it starts pushing some of that alginate out the back of the mouth. Then, you'll go back in the mouth. Again, use your finger there to get it out of the way. You'll push up on the back, and then you'll push on the front and watch it flow right up there. And once you see that, and then you'll hold it steady, just like that. Once you start to see it flow up and over those anterior teeth, then you know you've seated it completely. A lot of students will ask, how do I know if I'm overseated or underseated? How do I know how much pressure to apply? And the answer is just experience. You'll learn it after time. So this takes about 2 minutes to set up as we're using regular set alginate. A lot of offices, once you get the hang of it, you'll use fast set alginate. Here we tend to use regular set because you're learning and it takes a little bit extra time. So you just warn the patient, a couple more minutes and it'll start to firmen up. Notice I'm holding it on both sides so it's nice and stable. You don't want it moving or rocking. And then you'll just let it set up. Alright, so it's been about 2 minutes now, and I'm going to just push on the alginate to make sure that's nice and set up. And it feels nice and firm. You can also check the alginate from the bowl that you mixed, knowing that this is going to set up a little slower because the temperature of the mouth will actually increase the setting time. Also, if you had warmer water, that might increase, or less water, that will increase its setting time and go a little quicker. So what I usually do is go up back in the back of the mouth there with my finger, and then just pull down on the handle and pop that seal just like that. And when it comes out, you should get a nice impression of all the teeth with a good roll all the way around the peripheries. So that looks like a good impression there. Alright, now onto the lower impression. Again, we're going to try in our tray. Make sure that it fits all the way around. And the tricky thing about a lower is making sure that the tongue can have enough space and that we have enough space for all the teeth there. We typically will take the lower impression after the upper impression. That way we get the gagging one out of the way. The upper impression is harder, so then we can inform the patient, hey, the lower one's going to be a little bit easier for you. Again, for a lower impression, we typically only use 2 scoops of alginate, which we've measured out. Therefore, we only have the water filled up about halfway for the 2 scoops. So we'll go ahead and mix it the same way by putting the water in, getting it all incorporated, mixing it around. Again, smashing it along the sides to get the air out as well as the bubbles. Mix it around so that all of the powder's out. Scoop it all up. And then load your tray. Again, you want to try not to overload it so you don't make the patient have a ton of this in their mouth. Good. And then you're going to want the patient to relax a little bit. Go ahead and lift your tongue to the roof of your mouth and then rest it on top of the tray. That'll usually seat the tray plenty enough. Open for me. And then also gets their tongue out of the way. And then you just hold it steady. And then after a couple of seconds, I'll have the patient lick their top lips side to side. So go and stick your tongue out and try and lick your lips side to side. Good. And then relax your tongue. That'll also help you seat the tray. Alright, so it's been about 2 minutes now, so we'll check it. And it feels pretty firm. So we're going to go ahead and pop that out. Again, trying to get your finger all the way to the back of the mouth. Pull up on the handle and hear that pop come out. And it should be good to go. Again, you can see all the teeth and then the nice roll all the way around. And then once you've verified with the doctor or with one of the instructors that you have a good impression, then you're going to wrap it in your wet paper towel and then place it back in the bowl that you mixed. And then you can go ahead and either take it to the lab or place it into your plastic Ziploc bag with the other impression when you're done. And then you're all set.